I've been asked to deliver this talk on an alternative for the Visian Stroke Star ICL that we all know about. So the phakic intraocular lens that I will be talking about today is the Biotech Eycryl phakic IOL. And this is a user review. Now, for any one of you guys that know me, this is not me at all. I always promote using, top niche products for our patients. And I think we should properly serve our patients with, especially if in the field of refractive surgery. I would do a premium ablation profile for anyone. For someone who is like a -1 with very low higher order aberrations, I would definitely choose either a topography guided ablation or a wavefront guided ablation. If I'm doing a phakic intraocular lens, then I would definitely choose something that has been tested over the years. The reason I'm doing this talk is that at one point I had to use, I always thought of the other brands, including the Eycryl Biotech, as an ICL wannabe. And I wasn't very much enthusiastic about using them until I used one and I changed my mind. So this is a very short presentation. At one point, we used to tell our patients that they had only two choices if they wanted refractive surgery, either do a surface ablation or do a lamellar surgery in the form of LASIK, whether it is a mechanical microkeratome LASIK or like the good old days. I enjoyed the video that showed us today with the Hansdome, or in of course, modern times with the Fem2 LASIK. But now we have other options in the form of phakic intraocular lenses. We've been using ICLs in patients that had, well, not even moderate myopia, but even low myopia in -3s and -4s. And we have been using phakic intraocular lenses as well in patients that we could not do cornea-based refractive surgery on, like thin corneas, even irregular corneas. If you do have like a regular irregularity and you have a central cone, Dr. Mohamed Shafi has a publication on using toric ICLs in patients with keratoconus. So the suggested guidelines for phakic intraocular lenses, they are definitely, they do have advantages. They do not require corneal tissue removal. They themselves are removable in case of any potential complications. They have been shown to provide better contrast sensitivity and better quality of vision for our patients. Okay, it's not advancing. Yeah. So the only thing that you really need to know, and this is something that is against the second nature of implanting an ICL, if you're going to use the Eycryl Biotech phakic IOLs, is that the orientation holes are exactly the opposite. So the first time you're doing it, said, wow, I'm doing it the wrong way, this is an upside down. But this is not upside down. They deliberately put the holes in other directions. So this is something for you to know. Now, the other thing is when you start using these lenses, they're pretty stiff. They're much stiffer and stronger than an ICL. So this is something that actually makes you worry a little bit. But when you use it, and after using it for a couple of times, you see that this is actually an advantage and not a disadvantage. Why? Because it keeps the vault. If it is properly sized, you're very much reassured about the patient over the next years, because you know that it will keep the vault. And there has been a study in the past. It was a presentation in the past ESCRS in Milan by Sheetal Brar, and they made a dynamic OCT in patients that had Visian Star ICLs versus the Biotech Eycryl ICLs, and the amount of displacement during accommodation in the vault was much less with these type of lenses. So can you run the video, please? Now the loading of the Eycryl phakic IOL is supposed to be very easy, because you just pop it in the very normal cartridge that we've been using for many other lenses as well, and you pop it inside the eye without, I always tell my patients in the ICL, the operation has two halves. half of the operation is done on the lens, and then half of the operation is done in your eye, which each one takes like a couple of minutes. So the loading of the ICL has always been something that you should teach the trainee. I've been, over the past like 20 years, implanting ICLs without the use of the forceps at all. I just push it from the backside into the cartridge itself. Dr. Shafi has been doing the same as well. And we have reported very, very low, actually no incidences of tears or nips from the ICL that is actually is caused by the forceps itself. The Eycryl phakic IOL is firm and robust, and this is something that is reassuring. This is not something that you should worry about. You can hold the lens with any forceps, and manipulation inside the eye is very easy. Again, the manipulation inside the eye for the ICL is again very easy. And sometimes when I get called to an OR where one of my junior colleagues has implanted an ICL and it is upside down and is like sitting there not knowing what to do, flipping the ICL inside the anterior chamber is very, very easy, and you can actually do this with proper protection of the endothelium. The design of the Eycryl phakic ICL, you have the spherical type, you have the toric type. They're both very good. And again, the rigidity of the lens is something that is reassuring, that when you see it on the next day, you know that it's away from the crystalline lens and again away from the cornea. There has been publications reporting good results. This was one of the first publications. It was a Turkish group, but the group that is taking the lead in publishing results for the biotech Eycryl ICL is the group of Sri Ganesh in India. Sheetal Brar has been publishing, I think, 4 or 5 articles regarding the results of the biotech, and it's really, she's reporting very good results. Now, the first time I implanted this lens, it was a patient that had myopia of -24, and when I implanted this lens in this patient, I was surprised, because we all know that when we implant an ICL, sometimes the patient is not bang on the zero. Sometimes on the second post-operative day, you find the patient like with a -0.75 myopia and another 0.75 astigmatism. For example, if you're implanting a spherical lens, even in a patient that didn't have astigmatism preoperatively. And we're all happy. The patient's happy, you're happy, everyone is happy. And sometimes he needs very, thin glasses for driving at night. Surprisingly, when you start doing these lenses, they are very, very predictable, even in high errors. So it has a calculator, an online calculator, and the plus point is that it has an extra funny thing. It shows you the amount of inventory. So if, for example, if you choose a lens, it gives you how many lenses are in stock in the company. So this is something that is a plus point. Again, it runs with the same rules as the toric ICLs. In other words, it's always implanted in the horizontal plane. And this is something that you really have to know and have to take care of, because in these patients, in all toric ICLs, I do a toric check on the second day and with the eye trace. And when you do that, it tells you how much you have to rotate the lens if it needs to be rotated. And this has nothing to do with the orientation of the lens itself, because it tells you, for example, that the lens is, or the toricity of the lens is oriented at 120, and you have to move it or rotate it for like 20 degrees. And when you dilate the patient, the lens is in the horizontal axis, so you actually have to, sort of disengage the position of the lens from the position of its toric effect. Again, can you run this video, please? Removing of the ICL is very easy. I haven't removed this Eycryl lens before, but again, removal of the ICL of this model is easy. It doesn't need any cutting. It doesn't need any extension of the wound. And by saying this, because some of the patients, if you have a complication in the form of a cataract, which is something that I did once in my life, sometimes if you open the wound a little bit and take the lens out, doing a phaco is a little bit challenging because you do have a leaky wound. So this is, again, at least you have a 3.5 millimeter incision size, which is the good old incision when we used to do phaco back in the day. Again, its vaulting and sizing is very predictable. In the ESCRS at the biotech user meeting, there was a study that I told you about, reported less volt travel during accommodation by dynamic UBM and OCT. Now this is, I think this is the most important slide here, because this is the marketing material that the company gives you, but some of these items are important and some of these items are not important. They report easy loading, but again, we all know that the STAR ICL or the Visian ICL, again, is very, very easy to load. So it's not a complicated loading. This is not a fact. The incision size is less, it's 2.8 millimeter, and this is a plus point. The plus points I'm putting in green. And it is aspheric, and something that we don't all know is that not all STAR ICLs are aspheric. The V4C versions are not aspheric, but the EVO range is aspheric. So these are not the same thing. So a lot of doctors think that it's only the same, it just comes in different packages, but no, the EVO range is aspheric and the V4C is not aspheric actually. It has a wider range than the Visian ICL. This is the conclusion slide. So in conclusion, the Eycryl phakic lens is a good option for high myopia and astigmatic correction. Can be used in low myopic patients. It is easy loaded and handles easy, very easy. Available in a clear advantage in our market, because now there is a problem in the availability for Visian STAR ICL, at least in our part of the world. It gives less vaulting travel, and many clinical publications backs for efficiency and safety of the IOL in myopia, astigmatism, and in keratoconics. Thank you so much.
Thank you very much, Dr. Mohamed. Now,